how long have you been using MirrorMe in your practice?
I've been using MirrorMe3D for now about 2 years.
Oh, wow. Okay. Yeah.
One of the
A long
OGs.
time, for sure. Do you remember your first MirrorMe case?
I do actually, because I received the full kit with, the before and after
The models? Yeah.
And, basically from start to finish, it was the evaluation, kind of deconstructing what needed to be done. And it really made me rethink the way I was doing rhinoplasty.
Nice. All right. And then the product you use the most by far is the splint kit. So a quick primer for anyone new to them. These are postoperative patient-specific splints for rhinoplasty patients. So Dr. Layke, what has been most exciting about incorporating these within your practice?
I always felt that regardless of the planning and execution of the surgery, that sometimes the postoperative course, it was so random and varied so much from patient to patient, depending on the thickness of skin and the potential procedures that were being done in that operation, that the post-op recovery was all over the place. And so the traditional means of trying to tailor taping, tailoring the swelling was really, we were limited to something that seemed so archaic, and it was taping the nose. And I felt like, oh my gosh, if a patient missed a day of taping, that suddenly we've lost the results. And in adopting the 3D splint, what I noticed is that I could really control some of the outcomes. And it just became apparent just comparing those two options.
Got it. And as far as from, the few years we've been doing this, from the splint kit, that's patient specific, to taping, how have patients responded?
Patients love it. I think, the problem with taping, everybody complained, about the goop that was on the adhesive, the tiny little chad that hung down, from the end of the tape. And, it seemed to be just as obtrusive as the original surgical splint. So, with the new 3D splint, the fact that it's clear acrylic, it does help that we're in a pandemic and people are wearing masks. But prior to that, I would find that patients would wear it because it was a clear acrylic splint that kind of just fit onto the nose, and they could forget about it. And so it wasn't, some people would even go to work with it.
Interesting. Okay, that's nice. That makes it even better for post-op recovery for sure. From your patient population and the types of cases, what kinds of patients do you use the splints most often for?
In the early adoptive period, I was using it strictly for primary rhinoplasties. And then I said, well, that doesn't make any sense because of, potential for scar tissue and things like that. So then I used it for secondary, tertiary rhinoplasties. Now I use it for 100%, as many as I can. I don't even really at this point give the patient the option. It's, right in the quote, and I tell them about it. The one important thing that I think that I've noticed is that it keeps me honest as well, because it really makes you focus intraoperatively on achieving the result that I've promised the patient.
Got it. That's a great thing to have, I think. And then one other, sort of technical operational thing for the splints, do you recommend typical wear to patients, or how do you help them move throughout the kit since it's a series of 3?
So at their first postoperative visit, for the first week, I stick to, I'm still at the traditional phase where I have a surgical splint that I do have tape underneath. But as soon as that splint comes off, I know that I've got a window of a few hours before the nose starts to swell. And so I have them, we start off, there are 3 of the graded splints that are within the kit. And we start with the largest one. And if for some reason the patient doesn't swell as much and we can get them into the second one, I try to push the envelope a little bit. I notice that we can help mold a result, and I want them to wear it 24/7, as at least for that first week. Yeah. But for the first 5 weeks after they get the surgical splint off, they're wearing it at night for sure. If they can wear it during the day, it's icing on the cake.
Very nice. And then, because you've been at this for a little while, are there any firsthand patient experiences you could share that you heard back from them on?
As far as positive, most people, I'll tell you, I can say that probably 80% of patients don't want to stop wearing it at the 6-week mark. It gives them something to do. It protects the nose. It gives them this feeling that they have some control over the outcome. And when you see that you can get a later result much earlier, it's a no-brainer. So I have 2 particular patients. One, she was on the doctor. We did a segment on the doctor's TV show, and extremely large nose. And I knew that we needed something to help mitigate some of the swelling. And she was wearing that splint probably for the first 4 months, I think maybe even to 6, occasionally. And so, and her experience was always, it was kind of like an accessory that she was bringing with her, and she felt naked without it.
We actually get a good amount of feedback, even though it's a little bit past maybe what you would advise clinically. Patients keep wearing them up to 6 months, some even longer. So that part's been really cool from a product development perspective. To close out, do you have any advice for surgeons who are just starting to think about using the splint, or just starting to incorporate the splint within their practice, a way to optimize the adoption of it or their patient's experience?
Sure. Well, listen, a couple different things. One is, I would say, I used to offer it as an extra. Someone who would tack on. And I don't think it was adopted as easily as when I just added it to my surgical quote and everyone got it. And when you prepare the patient beforehand and say, listen, for decades we've been using traditional taping. I do have now a clear acrylic splint that's going to be almost like adjustable trays for the teeth, and it will slowly help mold the nose. And if we can get you a later result earlier, every single patient says, I want in. And so this is during the consultation. The second thing for the surgeon from the technical aspect is, I think looking at the analysis is great, because you know in your head what you need to do. But sometimes getting the accurate angles, number of millimeters of reduction, percent reduction, these are all things that help you start to realize what it truly takes to get to the result that you are promising. In the beginning, I'll be honest, I don't think that I did that for every single case. I think, you would promise something and then what you gave them was similar, but not quite. Now I really try hitting that simulation. So I would rather have 95% of the time hit the exact simulation. So when they do put that splint on, the first one fits perfectly, because that lets you know that you've already made the patient happy because they've agreed to that simulation, and you already know that it's going to look better than what it started, at that first post-operative visit.
That's amazing. I am so excited to have had this time with you today. I really appreciate it.